She has been knocked down, so she's now on the operating table, so that Lisa and Rachel can have a look at her teeth, because we know that she's had some broken canines for a little while. And where we used to feel the best thing was to leave the problem if they weren't showing any obvious signs of discomfort, so for example having problems eating, pouring at their mouths, or feeling just generally sort of low in themselves, we thought maybe it's best just to leave things be and monitor it. But now Matt, our new vet, his approach is a bit different. It's more proactive, and thankfully, because Lisa's just so generous and kind, she's come forward to help to look after our collection and care for their teeth, especially in their older age, and make sure that any existing problems that they have don't get any worse. So we're seeing already with Zia, having knocked her out, being able to get a good look in her mouth, that her teeth are in a bit of a worse state than we thought, and she has got some signs of infection around her gum. She's got a broken back tooth that we wouldn't have been able to see. We could only really see the problems with her fractured canine teeth. So she's now having some work done to prepare her for the root canal filling. So it's putting me off going to the dentist for a while, I have to say. But she's in really, really good hands. And although it's always a bit of a worry to knock the animals down, I've got ultimate trust in Matt, and know that it's definitely going to be long term for the best for her. So whatever time she's got left, she's not going to be suffering any pain or discomfort, and hopefully we'll make sure that we prevent any more issues with her teeth as well.
And just lastly, obviously just told us how attached you are. What's it like for you when she's on the table? Are you always worrying about it?
I am quite neurotic. I know I don't get much sleep the night before, and it's just because, you know, although we've got really good knowledge now about how to knock the cats out, and Matt's always really careful and does lots of research into which cocktails of drugs to use and at what levels to use them at and so forth. We also hand injected her some of the drugs rather than gave them all by dart. So all these things are really positive, but we always know that animals can react in strange ways, just as humans can, and yeah, there's always a degree of risk, of course, which we have to reconcile ourselves with, that if we're going to try and look after their long-term care, then obviously we have to do these things. So yeah, it always massively worrying, of course. You know, the thought of losing her is very tough, but at the same time, she's 17 years old, she's had a good life. So far so good though today, she's doing really well. Brilliant.
Thank you very much.
She's fractured one of her back teeth, and she's taken a whole slab that goes under the gum margin. So on the x-ray we can start to see that there's infection around the root. So the plan is that we're going to see if we're going to be able to take out all the infected tissue and do a root filling on the tooth. If not, we might need to extract the tooth. But it's a functional tooth, it's a big tooth that they use to chew, so if we can save it, it's going to be better to save it.
So what will you be doing with these bloods, Matt?
Basically send them for a full health profile, so just to check all the basic hematology and biochemistry. And it's just going to act as a reference as well, so if she gets ill at any point, we know what normals are for her. So it's always good to take the bloods when you get an opportunity like this.